Have you ever dealt with one of those really elusive problems? It's not like a full-blown crisis, but it's just there.
Yeah, sort of lurking.
Exactly. Constantly, subtly affecting everything. But you just can't seem to pin down the root cause. Like maybe a check engine light flickering, or that tiny leak you smell but can't find.
Right, that kind of thing.
Now imagine that frustrating feeling. But it's happening to your horse, and it shows up as chronic diarrhea.
It's surprisingly common, actually, and yet it's an incredibly perplexing health issue in horses. So today on the deep dive, that's exactly what we're going to try and untangle. Chronic diarrhea in horses.
Yeah.
And believe me, it's way more complex than just, loose manure.
Totally. And when we say chronic diarrhea, what we mean specifically is diarrhea that lasts for more than, say, 2 to 4 weeks.
Right.
It could be constant, or it might just flare up now and then, intermittently. And this work, it's a bit tricky, I think. Unlike that really severe acute diarrhea,
The scary kind.
yeah, the emergency kind with like rapid dehydration, maybe endotoxemia, chronic diarrhea often looks quite different on the surface.
That's a really crucial distinction to make. Because while it is serious, a horse with chronic diarrhea might actually look bright and alert.
Deceptive, right?
Very deceptive for an owner. Because even though they seem okay, they could be steadily losing weight, their coat might get dull, poor quality, they could develop ventral edema.
The swelling underneath.
Yeah, that fluid swelling under their belly. And they might even get these intermittent bouts of colic.
So our mission today is really to get a handle on this complex condition. We're going to dig into the surprisingly wide range of potential causes. The detective work involved in actually diagnosing it, which sounds intense.
It can be.
The specific treatment approaches, once you figure out what's going on,
Hmm.
and sort of what the future might look like for the horse and owner.
And we have to stress up front the frustrating part. For a lot of these cases, maybe even up to half, a specific cause just remains idiopathic.
Meaning?
Unknown.
Unknown origin, yeah. It's a real puzzle, even for experienced vets.
Okay, so to start cracking this puzzle, let's maybe lay some groundwork about the horse's gut first.
Good idea. So chronic diarrhea, fundamentally, it's usually a sign that there's an underlying issue affecting the large intestine, mostly the colon and the cecum.
Right.
It messes up that really delicate balance of how fluids get absorbed and secreted, how the gut moves the motility, and how permeable the gut wall is.
And for the horse, this isn't just about having a messy tail, is it? The signs go way beyond just the diarrhea.
Oh, absolutely. You're looking at things like recurrent colic, which is stressful for everyone, significant drops in body condition score, they get thin.
Muscle wasting, too.
Noticeable muscle wasting, yeah. And that poor hair coat that just looks unhealthy. And I think you found that interesting point about the less obvious signs like the ventral edema.
Yeah, the fluid swelling. You mentioned it can indicate hypoproteinemia. Exactly. Low protein in the blood, which is a really concerning sign because it tells you this isn't just a gut surface issue, the body's losing essential protein. It's a clue. The problem runs deeper.
Wow.
And then, of course, just the practical side, the constant fecal staining on the hind legs and tail that can lead to skin irritation, dermatitis, just another layer of discomfort.
And you also mentioned something called intestinal dysbiosis. What's that about?
Right, dysbiosis. This is a really key concept now in gut health. It's basically an imbalance in the gut microbiome.
The gut bacteria.
Yeah, that whole community of trillions of microbes, the good guys versus the bad guys, essentially. When that balance gets thrown off, it's a major contributing factor to altered GI function. So it's not just about inflammation or irritation, it's about the whole ecosystem inside being out of whack.
Okay, so that sets the stage.
Yeah.
Let's peel back the layers now and really dive into the why. Why does chronic diarrhea happen?
Well, like we said, we have to start with that challenging reality. In maybe up to 50% of cases, we just can't find a specific cause.
That's incredible. And hugely frustrating, I imagine.
Immensely, for everyone involved. But when we can find a cause, inflammation is a really big player. We call this inflammatory bowel.
Now, when you think IBD, it makes me think of like Crohn's or colitis in people. Is that a fair comparison? Are there horse-specific things we should know?
That's a great question. And yeah, the basic idea, immune-mediated inflammation, problems absorbing nutrients, it's similar. But horses, well, they present unique challenges. Diagnosis, for one, getting biopsies is much more invasive.
Right.
And there are a few types we see in horses. The most common is lymphocytic plasmacytic enteritis. Then there's eosinophilic enteritis.
Eosinophilic. That sounds like allergies.
Often linked to allergic reactions, exactly. So if a vet suspects that, diet becomes a huge focus immediately. There's also granulomatous enteritis. And then the really severe one is MEAD, multisystemic eosinophilic epitheliotropic disease.
Multisystemic, so it affects more than just the gut.
Yeah, multiple organs. It's a very serious systemic condition. But fundamentally, with IBD, all this inflammation messes up nutrient absorption, fluid regulation, leads to maldigestion, malabsorption, protein loss. We suspect it's often the immune system going haywire, or maybe there's allergic reactions to feed components.
All right, inflammation is a big one. Now, for something that sounds almost simple, sand. How can just eating sand cause such a chronic problem?
It sounds mundane, but it's a very real issue, especially in sandy areas, like parts of California or Florida, or even just if horses are fed on the ground frequently.
They just ingest it over time.
Exactly. And it accumulates in the large colon. Sand is abrasive, right?
Yeah.
So it just constantly irritates the lining of the intestine. It causes inflammation, sometimes ulcers, and it definitely alters how the gut moves. It's a physical irritant causing a chronic biological response.
Wow. Okay. And then you mentioned a parasite, larval cyatostominosis. Sounds nasty.
It is. And this one is particularly sneaky. It's a severe inflammatory reaction, but it's caused by the mass emergence of encysted, small, strong-tail larvae cyatostomins popping out of the intestinal wall all at once.
Encysted, so they're hiding.
They're hiding in the gut wall. And this mass emergence causes huge damage to the mucosa, massive protein loss. But here's the really counterintuitive part, the sneaky bit. Routine fecal egg counts. They often come back low. Or even negative.
Why is that, if they're there?
Because the larvae causing the problem are encysted. They aren't mature adults shedding eggs yet. They're dormant, then emerge en masse. So a clean fecal test doesn't rule this out at all. It's a critical point for diagnosis.
That is vital info for owners. A clean test isn't always clean. Okay, moving from parasites to meds, right? Dorsal colitis, or RDC. You linked this to NSAIDs.
Yes, specifically, there's a critical link to the overuse or misuse of non-steroidal anti-inflammatory drugs. Phenylbutazone, or bute, is the most common culprit.
Bute is used a lot.
It is, and it's very helpful. But too much, or given under the wrong circumstances, can lead to ulceration and severe inflammation, specifically in the right dorsal part of the colon. Things like dehydration, being sick already, high doses, or using it for too long, those are all risk factors.
So even helpful meds have a dark side if not managed carefully.
Absolutely. It's a reminder about responsible medication use.
Okay, what about just diet and general gut balance?
Hugely important and maybe sometimes overlooked. Sudden changes, new type of hay, different grain, adding a supplement, those can really throw off that gut microbiome we talked about.
Disrupt the balance.
Exactly. Forage quality matters too. Moldy hay is obviously bad, but even pasture that's too rich, or diets that are too low in fiber. They can all upset digestion. And while maybe less common, you can have actual intolerances or allergies to specific feed ingredients.
Right, and infections. We think of those as sudden, like a stomach bug. Can they cause chronic diarrhea?
Usually they are acute, yeah. But sometimes they can linger or become intermittent, so we do need to consider them. Things like salmonellosis.
That's the contagious one.
Highly contagious, yes. Horses can become carriers, shed it intermittently, requires strict isolation. Then there's Clostridial enteritis from C. diff or C. perfringens, Lawsonia intracellularis that causes equine proliferative enteropathy, mostly in foals, and Potomac horse fever, usually acute, but can sometimes drag on.
And you also mentioned a few really serious, less common things.
Yeah, briefly, things like intestinal cancer neoplasia, like lymphoma or adenocarcinoma. Chronic liver disease can sometimes manifest with diarrhea. And even deep intra-abdominal abscesses. Those are rarer, but definitely on the list of possibilities.
Ooh, okay. Wow. That is a lot of potential causes. So how on earth does a vet even begin to figure out which one it is? This sounds like real detective work.
It really is. And like any good investigation, you start with the story, the history.
Gathering the clues.
Exactly. A detailed history from the owner is absolutely paramount. The vet needs to know everything. How long has this been going on? How often? What does the diarrhea look like? Watery, pasty, mucus, blood?
The gory details.
All of it. What's the exact diet? Any changes recently? What's the deworming history? Critically, any NSAIDs use. Has the horse traveled, been exposed to new horses? What's the water source? And any other signs, weight loss, colic, anything.
Building that timeline.
Precisely, building that complete picture.
Okay, so after the history, the eyewitness account, what's next? The physical exam?
Yep, the hands-on clues. The vet will assess the horse's overall body condition, check hydration levels, and look specifically for that ventral edema we mentioned.
The swelling.
Right. And then, listening to the gut-abdominal auscultation, they're listening for gut sounds. Are they too fast, hypermodal, or maybe too quiet? And sometimes, surprisingly, you can actually hear sand sounds.
Can hear sand.
If there's enough, yeah, a kind of gritty sound. And then a rectal exam is usually performed, feeling for thickened colon walls, maybe feeling sand accumulation directly, or any abnormal masses. It all helps narrow things down.
Okay. History, physical exam. Then I guess you need to look inside somehow. Lab work.
Exactly. Peeking inside with lab work is the next step. Blood tests, a CBC, complete blood count, and a serum biochemistry panel are crucial.
What are they looking for there?
Signs of anemia, maybe? Indicators of inflammation or infection, like changes in white blood cell counts. But critically, they're looking for low-protein hypoproteinemia or hypoalbuminemia.
The protein loss thing again?
Yes, it's a major hallmark of several causes, like IBD, larval cyathostomonosis, RDC. Tells you protein is leaking out through the damaged gut. They'll also check electrolytes and maybe specific inflammatory markers like SAA, serum amyloid A.
Okay. And fecal tests must be important too, right, given the main symptom?
Absolutely central. A fecal egg count, FEC, is standard to check for adult worms. But remember that big caveat.
It can be negative even with the larval cyathostomes.
Exactly. So a negative FEC doesn't rule that out. Then you have specific tests like fecal cultures or PCR tests looking for bacteria like salmonella. And for salmonella, you often need multiple samples because horses can shed it intermittently.
Right. You need a few tries maybe.
Yeah. Same for Clostridium species in Lawsonia. And then there's that wonderfully simple low-tech test.
The sand test.
The fecal sand test. You literally mix some feces with water in a rectal sleeve or a glove, let it settle, and see how much sand sinks to the bottom. If you get more than, say, a teaspoon, that's pretty significant.
That's brilliant. So practical.
It really is a great field test.
What about imaging? Can you see these problems with ultrasound or x-rays?
Yes, imaging is very helpful. Abdominal ultrasound is great for looking at the intestinal walls themselves. Are they thickened? That can point towards IBD, RDC, or general colitis. You can also see fluid in the abdomen or enlarged lymph nodes.
And trace?
Abdominal x-rays or radiographs are actually the most reliable way to quantify how much sand is in the large colon.
Really? X-rays for sand?
Yep. Ultrasound isn't great for seeing sand, but x-rays show it up quite well. So that's the go-to if sand accumulation is suspected.
Interesting. Okay, are there even more specialized tests if the answer is still elusive?
Definitely. If things are still unclear, we might move to something like an oral glucose absorption test.
How does that work?
You give the horse glucose solution orally and then measure blood glucose levels over time. It checks how well the small intestine is absorbing sugars. If you get a flat or blunted curve, meaning the blood glucose doesn't rise much, it suggests there's a problem with absorption in the small intestine.
Okay. What about biopsies? Getting actual tissue samples?
That's often the next step for conditions like IBD. A rectal biopsy is relatively easy to get, but it only helps if the inflammation actually reaches the rectum, which it doesn't always.
So it might miss the problem area.
It might. The gold standard, really, though it's much more invasive, is a full-thickness intestinal biopsy. That usually requires surgery, either an exploratory laparotomy or laparoscopy, to get a piece of the affected bowel wall. Gives the most definitive answers, but obviously carries more risk and cost.
Right. A big step.
A big step. And sometimes, if a feed intolerance is high on the list of suspects, the vet might recommend a controlled dietary trial. Basically, an elimination diet, changing one thing at a time to see if the diarrhea resolves.
And you mentioned earlier there's no test for dysbiosis itself.
Correct. That's a really important point. We know gut microbial imbalance plays a role, maybe a huge role, but we don't currently have a reliable diagnostic test to say, yes, this horse has clinically significant dysbiosis. It highlights that there are still mysteries within the gut we can't fully measure yet.
Which must make treatment tricky sometimes.
It does. Which brings us to, well, touring the path forward. Treatment and management. And this really has to be tailored. Treatment is highly specific to the underlying cause, if you can find one.
And if you can't, if it's idiopathic.
Then treatment becomes more empirical based on experience and the most likely scenarios and supportive. Managing the symptoms, supporting the horse's overall health, trying to restore balance, even without a definitive label.
Okay, let's talk specifics. If it is IBD, what's the approach?
For IBD, corticosteroids are usually the main treatment, things like oral prednisolone or dexamethasone, to reduce that underlying inflammation. Diet is also key, usually highly digestible, low antigen feeds, given in small, frequent meals to be easy on the gut.
Makes sense. What about the sand, besides trying to stop them eating it?
Right, prevention first, using feeders, rubber mats, hay nets. But for treatment, psyllium is the go-to.
Like Metamucil for people.
Exactly the same stuff. It forms a gel, helps bind the sand and carry it out, often given with magnesium sulfate, which is a laxative, to help things move along. In really severe cases where the sand causes an impaction, surgery might be needed to physically remove it.
Wow, okay. And those sneaky larval cyathostomes. How do you treat something hiding in the gut wall?
You need specific dewormers that are effective against those encysted stages. Moxidectin is generally the preferred drug now, as there's quite a bit of resistance to older drugs like fenbendazole for these encysted larvae.
So the right dewormer is crucial.
Absolutely. And because their emergence causes so much inflammation, corticosteroids are often used alongside the dewormer to manage that inflammatory reaction. It's a double hit, kill the parasites, calm the inflammation.
Got it. And for RDC, the NSAID-induced colitis.
The absolute #1 crucial first step is stop the NSAIDs. Immediately. That's non-negotiable.
Makes sense. Remove the cause.
Then it's all about dietary management, usually switching to a low-bulk, easily digestible pelleted feed and really restricting long-stem hay or forage initially to give the colon a rest. Gastroprotectants like sucralfate can help coat and protect the ulcerated areas. Sometimes an antibiotic called metronidazole is used too for its anti-inflammatory effects in the colon.
So rest and protection for the gut lining.
That's the goal. Give it a chance to heal.
Okay, what about the infectious ones if they become chronic, like Salmonella or Clostridium?
For salmonellosis, treatment is mainly supportive. Care fluids, nutritional support. Antibiotics are used very cautiously. Sometimes they can actually make shedding worse or prolong the carrier state. And isolation is critical because it's so contagious.
Right. Keep it contained.
For Clostridial enteritis, metronidazole is often the antibiotic of choice. Potomac horse fever usually responds well to oxytetracycline, especially if caught early. And for Lawsonia and foals, specific macrolide antibiotics are used. It's about targeting the specific bug.
Now, what about those frustrating cases? Idiopathic or where you suspect dysbiosis but can't prove it? What can you actually do?
Dietary modification is always central. Strict control, often simplifying right down to just consistent, good quality hay, making any changes extremely gradually. And then there's a really interesting option that's showing promise.
What's that?
Fecal transfonation, or fecal microbiota transplantation, FMT.
Wait, like transferring manure?
Essentially, yes. You take intestinal contents carefully processed from a healthy donor horse and transfer it, usually via stomach tube, into the affected horse. The goal is to repopulate the sick horse's gut with a healthy, diverse community of microbes.
Does it work?
Our sources say it can be very effective in some cases of persistent dysbiosis or idiopathic diarrhea. It's basically a microbiome reset. Probiotics and prebiotics get talked about a lot, but the scientific evidence for specific products in horses is often still a bit anecdotal or mixed. FMT seems more potent when indicated.
Fascinating. And you made a really important point earlier about not using antibiotics generally for unknown chronic diarrhea.
Yes, that's a key caution. Unless you have evidence of a specific bacterial infection that needs treating, broad-spectrum antibiotics are generally contraindicated. Strongly advised against.
Why? Seems counterintuitive if there's diarrhea.
Because antibiotics kill bacteria indiscriminately good and bad. If the problem's already an imbalance, dysbiosis, antibiotics can wipe out even more of the beneficial microbes, potentially making the imbalance, and the diarrhea even worse. You risk disrupting that delicate ecosystem further.
Right. Don't nuke the whole village to find one bad guy.
Exactly. So unless you know you're targeting a specific pathogen, you generally avoid them.
Okay. And beyond these specific treatments, what about just general support?
Crucial, especially fluid and nutritional support. Dehydration and electrolyte imbalances are common, so oral or sometimes IV fluids might be needed. And maintaining weight is a challenge, so providing high-quality, easily digestible feed is essential. GI protectants, things like pectin, psyllium, maybe bismuth subsalicylate like Pepto-Bismol, can sometimes help soothe the gut lining.
And you mentioned laminitis. That seems like a weird connection.
It's a serious risk, especially in severe or prolonged diarrhea cases. The damaged gut wall can allow bacterial toxins, endotoxins, to leak into the bloodstream. This systemic inflammation, endotoxemia, is a major trigger for laminitis, that incredibly painful inflammation in the hooves. So vets are always vigilant about preventing laminitis as a secondary complication.
Wow. So many layers to this. What's the overall outlook then? If a horse develops chronic diarrhea, what's the prognosis?
It's really highly variable. It completely depends on the underlying cause, how severe it is, and how well the horse responds to treatment.
Is there good news sometimes?
Definitely. Many cases related to diet or mild sand issues often resolve really well with the right management changes. That's the good news.
But the more complex ones.
The challenging cases like IBD, larval stominosis, RDC, they often require long-term, sometimes lifelong management. The horse might never be completely cured, or they might have flare-ups intermittently. It becomes about control, not necessarily a cure.
And the really severe cases.
For horses with severe, unrelenting protein loss or infections that just don't respond, or sadly, intestinal cancer, the prognosis is often guarded to poor. And in those situations, difficult conversations about quality of life and potential euthanasia sometimes have to happen.
So it sounds like owners need to be prepared for a potentially long road.
Absolutely. Chronic diarrhea in horses is complex, it can be incredibly frustrating to diagnose, and it often requires a significant long-term commitment from the owner and the veterinary team. A thorough workup is vital to try and find that cause because specific treatments offer the best chance. But even then, it's often about ongoing management, dietary vigilance, and regular check-ins. It's definitely a journey.
Well, this deep dive has certainly shown just how intricate chronic diarrhea is in horses. It's so much more than just a simple symptom, isn't it?
It really is. It's a window into the complexity of the equine gut and how easily that delicate balance can be disrupted.
And I think for you, listening, understanding this complexity is so important. It helps you spot those subtle early signs, maybe know what kind of questions to ask your vet, and just appreciate the real dedication involved in keeping horses healthy. It makes you a better advocate for your animal.
Definitely. A more informed owner or caregiver.
So here's a final thought to leave you with. Given how incredibly challenging it can be, sometimes impossible, to pinpoint the exact cause, what does that really tell us about the hidden resilience of horses? And maybe about the ongoing mysteries of the equine gut that still remain just beyond our grasp, even with all our science?